Welcome everyone. Today we're diving into the exciting area of healthcare innovation, vaginal swabs in primary care. This presentation is part of our 2025-26 Microbiology and Primary Care Improvement Project, and I'm thrilled to be leading the discussion. My name is Dr. Becky Mawson. I'm a GP in Sheffield and part of the Primary Care Research Group at the University of Sheffield, and I've been working with Dr. Helena Parsons, a consultant microbiologist. We aim to explore how we can innovate investigations and treatments in primary care settings. Our objective is clear. We want to enhance the way vaginal swabs are utilised, ensuring they're both efficient and effective. And we'll be discussing how this initiative can potentially transform patient care and optimise resources in healthcare system. Let's begin by looking at the current state of swab usage in our area and opportunities for improvement. Let us begin by considering the scale of the current situation. In Sheffield area alone, we're sending 12,100 charcoal vaginal swabs every year, and each of these cost over £19 to process, leading to a staggering total of £235,000 spent annually. Now, here's the crux of the issue. It's estimated that up to 90% of these swabs are unnecessary. Why? Because they stem from outdated understanding and practices dating back to the days of triple swabs. This means we're conducting intimate examinations that are not needed, using resources that could be better allocated, and taking time away from nursing teams that could be used more effectively. The benefits of reducing these unnecessary swabs are significant. We can also cut down on the volume of results that need processing and streamline our operations. Consider the implications of these changes, not just in terms of cost savings, but also innovation in quality of care provided. So let's delve into the benefit of these new tests that you might have seen out and about. These innovative molecular swabs are designed to identify 3 specific pathogens with just one swab. They test for common sexually transmitted infections, chlamydia, gonorrhea, and trichomonas. Now, it's important to remember the appropriate methods for sample collection, which are both provided within the same packet. You've got a vaginal swab, obviously for vaginas, and you've got a urine collection, which are for those with penises. These are taken by the patient, or if you are examining them, you can just do a low vaginal swab just inside the vagina before you put the speculum in. This streamlined approach is not only simplifies the testing process, but also enhances accuracy by targeting these specific pathogens. This includes everything from pre-fertility investigations to unscheduled bleeding to pelvic pain, and can be all done by the patient in their own home. So let's think about why we're moving away from these charcoal high vaginal swabs. First, it's important to remember that vaginas are naturally full of a diverse range of microbes, and this ecosystem is healthy and normal. Swabbing and treating indiscriminately can disrupt this balance. So we should only be performing swabs when we're specifically looking for something and when we have a clear diagnostic purpose. By being more selective, we avoid unnecessary treatment courses. Unless you ask for a specific pathogen, you will only get the results from microbiology for BV or Candida. And we've got to remember that BV, or bacterial vaginosis, is not a specific pathogen. It's just a name that suggests bacterial overgrowth, which links to changes in vaginal pH. So let's delve into pH testing as an additional tool for your diagnostic approach. Think of this as point-of-care testing that's both efficient and cost-effective. Let's first of all highlight the importance of pH testing. So healthy vaginas are slightly acidic. And when it comes to bacterial vaginosis, the pH level above 4.5, so more alkaline, is a clue to diagnosis. In contrast, if you're dealing with Candida, you'd expect a normal vaginal pH. The simple measure can be incredibly telling. And here's an interesting tidbit. This testing is budget friendly. You can obtain 100 tests for under £10. Just make sure you have the correct kite mark for quality control. Patients can even buy these easily from their online or chemist for home assessments. Sometimes I use that if people have certain discharge at different points of the month, they can monitor their vaginal pH. Remember, this is another valuable tool in your diagnostic toolkit, helping you assess and address conditions right from the point of care. So now let's talk about asymptomatic patients. It's crucial to remember that you do not need to send charcoal swabs in these patients. This is really important as it leads to unnecessary testing and can lead to confusion and unwarranted treatments. However, for STI screening, a self-taken low vaginal swab is an option. And if you find yourself examining the patient, you can perform the low vaginal swab, as I previously mentioned. Now, let's think about bleeding. So the microbiology team receive a large number of swabs that have been sent due to post-coital bleeding or bleeding after sex or postmenopausal bleeding. Now, there's no evidence for sending a charcoal swab in these settings, as we know that BV and Candida are not real causes for abnormal bleeding patterns. But STI screening, on the other hand, should be considered for both these groups, especially asking if they've got any sexual health risk factors. Now, let's think about symptomatic patients. So these are ones thinking specifically about premenopause and those who aren't pregnant. So when a patient presents with discharge symptoms, our first step is to assess for sexually transmitted infection. This is really crucial because we need to rule out common infections of chlamydia, gonorrhea, and trichomonas. Next thing to think about is potential physiological causes or non-infectious causes, and this helps us to get a clearer picture of what's going on. Consider the impact of synthetic hormones, so contraceptive hormones like progesterone-only methods, which we know can cause vaginal irritation and vaginal dryness. In many cases, it's efficient to consider empirical treatment. So, for instance, symptoms like itchiness, low or normal pH might be suggestive of Candida, whilst a fishy odour with high pH might be more indicative of bacterial vaginosis. For premenopausal non-pregnant patients, remember that vaginal discharge can be easily pH tested using the narrow range pH paper, as mentioned previously. So let's move forward to think more about symptomatic cases. So we're going to focus more on symptomatic perimenopausal, postmenopausal patients. So, as mentioned previously, let's focus on two important aspects. So ensure that patients are up to date with STI screening. Let's not make judgments about age, and let's ask everyone the right questions about sexual health risk factors. And then let's think first of all about physiological or non-infectious causes. When it comes to treatment, it's often effective to consider empirical treatment, as previously mentioned. But if women in the postmenopausal phase mention any bleeding, especially after their periods have stopped, it's really important to consider to refer them to the 2-week pathway, which is obviously the appropriate route. For those who are perimenopausal or postmenopausal, estrogen levels can play a significant role in vaginal symptoms. If someone starts with vaginal irritation in this specific group, then it's really important that we consider what happens when estrogen drops. Someone who has not any exacerbating risk factors like antibiotics, really be mindful of the impact of estrogen and treat as one of your first lines in this group with estrogen if someone's coming with vaginal discharge or vaginal discomfort. The other thing that it's really important not to miss is lichen sclerosis. It's really common in this age group, and often women have huge delays in diagnosis. They've often had multiple thrush treatments and no one's examined them or thought to look out for specific vulval skin conditions. So if you don't feel confident being able to examine someone for lichen sclerosis, get them seen by someone who can. Understanding these nuances really help us provide better care and make significant difference to patient outcomes. Now, thinking about pregnancy and managing discharge in pregnancy. So obviously, pregnancy is a risk factor for sexually transmitted infection. So we need to be really proactive about screening pregnant women for sexually transmitted infections. The next thing to consider is physiological or non-infectious causes. Pregnancy in itself can make you produce more discharge. You can use empirical treatments, especially if it is a good story for thrush or bacterial vaginosis. We don't routinely screen women for Group B strep at the moment in the UK, but there are certain situations that you really need to be thinking about in pregnant women, especially if they're further on in their pregnancy. Any foul-smelling discharge, especially if it's accompanied by fever, you would want to get them seen by the obstetric team for fear of things like chorioamnionitis or sepsis, which sadly can be life-threatening. Now, There are a few cases where you might want to send charcoal swabs for microscopy and culture. Firstly, consider if there's a fever or discharge after pregnancy or miscarriage, or any gynecological surgeries or procedures. These symptoms can indicate an infection, so it's crucial to act promptly. Secondly, within 3 weeks of inserting an IUD or a coil, if there's a fever or discharge, think about PID and other things that might be caused. And lastly, if you've got someone who's coming back multiple times with Candida or with BB symptoms, and you've done STI screening and you've ruled out estrogen issues or synthetic hormone related problems, and you've looked and examined and there's no problems with lichen sclerosis, in those cases, absolutely send a charcoal swab, but be very specific on the request form about what you're asking for. We do sometimes occasionally see a strep vaginitis in women who don't necessarily have discharge, but in the perimenopause and postmenopausal period of time. Remember, sending a charcoal swab is rare, but knowing when to do it can make a significant difference. So hopefully that's made it clear what we should be doing when we're managing vaginal swabs and symptoms. Hopefully together we can enhance vaginal swabs and make sure they're utilised effectively and efficiently for women. We're going to share more information of the guidelines that we've created and a link below within the video notes. So I hope that was useful, and look forward to your feedback and hearing how you get on. Thanks.